Welcome to our panel webinar, Experts on Gradual Return to Work. Thank you for joining us today. My name is Yusra Benjeloun, Administrative Coordinator and Projects Manager with the Work Wellness Institute, and I'll be co-moderating the webinar today. This webinar is made possible through the support of the Community Gaming Grant Program through the BC government, as well as donations and memberships to WWI. We're extremely excited to welcome our 5 panelists today. Dr. Tyler Amell is an internationally recognized thought leader on the topic of workplace health and productivity. He's an advisor on strategic and integrated workplace health. Dr. Amell is the Chief Health Officer and Chief Relationship Officer of Core Health Technologies and is on faculty at Pacific Coast University for Workplace Health Science. He also serves on the board of directors of the National Wellness Institute. Diana Vissers. Through Work to Wellness, Diana Vissers has been solving workplace mental health problems for individuals and organizations since 1999. She is an instructor and developer of a workplace wellness course at Simon Fraser University and leads multiple workplace mental health training programs across the province and for BC Municipal Safety Association. She is a CMHA certified psychological health and safety advisor. Jordan Friesen is the National Director of Workplace Mental Health at the Canadian Mental Health Association. His experience in a wide variety of roles, including clinical service delivery, case management, education, and nonprofit leadership, provides him with a solid understanding of the industry and in-depth knowledge of where gaps exist for innovation and collaboration. Dr. Kevin Kelloway is the Tier 1 Canada Research Chair in Occupational Health Psychology and Professor of Organizational Psychology at St. Mary's University in Halifax. His research focuses on issues related to organizational leadership, mental health in the workplace, and occupational health psychology. He has published over 200 articles and book chapters and 14 books dealing with these issues. Chris Back is the Director of Occupational Health and Safety of Consultation and Education Services at WorkSafeBC. Consultation and Education Services serves the workers and employers of BC by positively influencing health and safety behaviors and disability management practices through partnerships, consultation, and outreach. Chris has been with WorkSafeBC for 6 years. Dr. Cameron Stockdale is the Chief Executive Officer of the Work Wellness Institute. As the CEO, Cameron takes the vision for the organization and makes it reality through building high-performing organizational cultures and sound strategic planning. As a motivating leader who inspires action, he combines people-centric decisions with sound financial management to leverage business opportunities. Cameron would like to say a few words before we hand it over to our expert panelists.
Hello, everyone. It's my privilege to welcome everyone to today's session. I think today we've assembled an outstanding group of experts to talk about COVID-19 and the reopening of offices. So I'd like to extend my thanks to the panelists, first of all. And secondly, for those in attendance today, I would like to extend my thanks for taking time out of your day to join us. As you know, we derive much of our programming from ideas that we get from people who watch our webinars. So we would love to hear from you, not only when asking questions today of our panelists, but to give us things that you would find value in our programming. So as you know, the Work Wellness Institute has a broad mandate around health and welfare of employees. And the value of our programming is directly related to the feedback that we get from you. So to do that, simply go to our website. You can sign up as a member for the organization or send us an email to receive regular updates. So just a brief thank you for everyone who's in attendance today, and I will turn it back over to you, sir.
Thank you, Cam. So let's start with you, Tyler, if you don't mind.
Great, thank you very much, Yusra and Cam, for that wonderful introduction. And thank you very much for those of you who are in attendance today. It's great to see so much interest in what it is that we are trying to provide some evidence-informed strategies, really to help organizations look at what's coming down towards their activities in the near term and how we can actually help support that wherever possible. Now, first things first, I think it should come as no surprise to anybody on the call that this pandemic is not over by any stretch. We're not even 50% of the way through this experience, regardless of what you see on the media or hear people declaring these sort of things. The SARS-CoV-2 virus is still in the wild, and people can still get COVID-19 disease. Myself, being an occupational epidemiologist, I've never been more popular than I am right now. As sad as it is, nobody listens to us when we're not in a pandemic, but we're in a pandemic, and that there is a fair bit of interest in our control and prevention strategies, helping people inform their strategy and so on and so forth. Now, what I will say is that we have managed to slow the spread in many ways and in many jurisdictions, which is quite good to hear. Exponential growth is behind us. So employers and organizations can rest assured that, at this point in time, we're sitting in a pretty good position in most jurisdictions. There's a big asterisk there because there are areas that, have perhaps relaxed things a little bit too early and are bearing the repercussions of that right now with increased case counts and a few other issues. So there's a caveat there. The worst is behind us for now. Now, one of the other things that I did want to mention as we sort of kick this off, at least from my perspective, is that in the work disability space, we talk about the notion of return to work, as part of our normal verbiage, right? We talk about return to work all the time, but it's usually through the lens of returning people back into the workplace after a bout of illness. Perhaps an absence or leave tied into disability or some health issue, perhaps mental health or physical health. Now, this case, it's a little bit different because when we're talking about return to work, we're really talking about return to the workplace. We have a huge number of people who've been laid off or furloughed, and we also have a very large number of people who've been working remotely for the past few months. And it's quite insulting to a lot of those people whenever experts like us come on and start talking about return to work, when their reaction, of course, being people who don't necessarily speak the language of return to work, thinking that, I've been working my butt off for 3 months, how dare you say that it's time to return to work now? So, it's just something that I think we have to be sensitive of. It's come up in a few webinars that I've been giving over the past little while, and it's definitely something that I think we as practitioners in the field need to keep that in mind as we walk through this process. Now, just a little bit of a review from the last session that we did. We did have various options ahead of us, and of course, organizations had the option to support a lot of these through various public health mandates, and then of course compliance with these sort of things. Now, for the most part, we have followed through on the green pathway here, and that's we had strong epidemic controls in place, physical distancing, masking, these sort of things, better than the alternative. The best case scenario for us is when all is said and done, people will question why we did this sort of thing. As sad as it is, that's the hallmark of a truly successful response to this sort of thing. So that's what we want, even though it is quite painful for us to get to that point. Now, of course, from a physical health perspective, flattening the curve doesn't really mean fattening the curve. And, I've been using this joke for a while now. It never ceases to get laughs. So, of course, I kept it in this one as well. Now, one of the common questions that we are getting is, what's the second wave going to look like, and is it going to arrive, and so on and so forth. It's difficult to start talking about a second wave when we're not even done with the first wave. So that's probably the first caveat here. From an epidemiological perspective, this virus will be the 5th endemic virus. So endemic basically means it's part of the background risk. That's not going away anytime soon. This virus is here to stay. We're not going to eradicate it. If anything, once a vaccine is available towards the end of the year and into 2021, we'll be able to substantially reduce the burden from an epidemiological perspective, but odds of us eradicating it are pretty low at this point in time. Now, from a high-level perspective, I put down a couple of points here to help guide the conversation, and I suspect that once everybody else goes through, we'll probably have some good questions from the audience. This will very much be a regional approach, if that's not evident to you already. You could have, even with the same jurisdiction, multiple rules in place depending on case counts and levels of activity. We need to be quite receptive at addressing surges and clusters of activities, and they may be work-related in the case if we look at like meat packing facilities or other areas as well. Now, one of the things that definitely is supported by the research is that we really have to listen to our people. You know, there is anxiety, there is fear out here, there's an awful lot of unknowns, and people are yearning for good information. So, you know, one of the recommendations that I've been putting forward is that, you know, there shouldn't be any rush to return to workplaces whatsoever. You know, it's best to be quietly confident that a metered, slow approach is definitely the way to go, but we do realize that there's lots of other pressure in place to sort of speed things up wherever possible. Well, if we look at some jurisdictions in the US that have sped things up, you know, we've got 20 states right now that are seeing a surge in cases. And so, you know, we have to balance these sort of things. I firmly believe that we do have the capabilities to reopen in a near full capacity, but at the same time introducing a fair degree of control measures in place so that we can reduce the likelihood of things going sideways and getting out of control back to the tune of exponential growth. I would also look at bringing people back in stages if possible. So the best course of action is to keep people out of the workplace if possible. I realize that's not the case. Maybe people can work remotely part of the time. You know, that seems to be a preference for a lot of folks these days. And then, of course, you know, very much a staged approach. There's one thing from a work disability perspective and workplace well-being perspective that must be considered, and that is the level of comorbidity. So there are a large number of people out there who have comorbid conditions, so obesity, heart disease, lung disease, these sort of things. Now, these people, whenever they do become infected, they do have a more severe case in many instances, which means that they have a higher likelihood of hospitalization and a higher likelihood of intensive care unit use. Communication has to be completely clear, open, honest, and very much front and center with regards to helping people address, you know, and deal with pandemic. Now, some of the other things are very much self-explanatory. You know, we can't let up on our hygiene, you know, our frequency of hand washing, cover your cough campaigns, the physical distancing measures, you know, that can't go away anytime soon. Masking, you know, from a research perspective, you know, this is probably one of the most singly beneficial things that can be done for individuals, particularly in crowded areas, you know, elevators, common areas, these sort of things. You know, that is definitely one of the things that has been shown to produce the best benefit. Now, one of the other things that's worthwhile for organizations to consider is, you know, there's never been a better time to look at investing in workplace health. You know, it's always a tough sell to get organizations to think about the mental health of the workplace and to think about the physical health of the workplace for a variety of reasons. But now, you know, the health is front and center. So, you know, I view this as a huge opportunity for people and organizations that they represent to really double down on efforts to look at, you know, improving the health of their workforce, because there's great benefits from a business perspective, but there's arguably greater benefits from an individual perspective. Now, from a benefit perspective, you know, now is probably a good time to look at modifications to your benefit strategy going into your next enrollment year. As I said before, these sort of things aren't changing anytime soon. I'd also like to flag that there will be an increase in use and interest in the seasonal influenza vaccines. So those are typically available in September and October. You know, one of the benefits of us having a pandemic in the summertime is that you've sort of ruled out some of the other conditions that are going to cause issues. So the last thing you want is to be battling influenza as well as COVID-19. So that being said, you know, there will be a rather substantial increase. It looks like in the US side, they're going to be setting aside an additional 25% of doses for that population there. Now, from a workplace perspective, you know, obviously the three biggest things that can be done are test, contact trace, and isolation. Now, together, these three practices, in addition to everything else that we know works quite well from this perspective that we'll get into in the question phase, are going to be elemental towards securing your organization's success as we move forward.
Perfect. Thank you so much, Tyler. And moving on to Diana.
Yeah, so thank you very much, Yusra and Tyler. You always have such interesting stories to tell, and you have really framed our dialogue today from the perspective of how do workplaces control for the risks and the spread, and as the return to work impacts on those risks, employers really need to be very nimble. And you know, you gave some great tips about the kinds of things they need to be evaluating and assessing for. So I want to, before I really dive into my recommendations, I want to just acknowledge with the number of participants that we have here today and how many workplaces we actually have the impact potential here for creating opportunity. Each person who's here attending is representing a workplace that is unique, that has its own experience of COVID-19 and what it has done in terms of their operational needs, the number of layoffs that may be in effect or not, and their own individuals in the workplace. So we have a great opportunity here to really change and improve the experiences of people as they are coming back into the, as work has changed through that return to work perspective. So, you know, whether you're here as an occupational health and safety person who's looking at the risks through that epidemiology lens, or through an occupational health and safety lens, or you're a human resource person who is changing policies quickly and adapting to you know, the emergent needs, like people are wanting information, the health officer changes the recommendations, how does this reflect on your workplace policies? My lens here today is from psychological health and safety. So you know, we talk about mental health and workplace mental health. To me, that fits within the whole frame of psychological health and safety. And truly, never have we had an experience that is universal. You know, I'm working with employers in all different parts of the planet, Africa, you know, Europe, the US, different parts of Canada, and the experiences are very similar in many ways. That employers are concerned, they're seeing evidence in their work population, people are coming forward, expressing challenges and difficulties, whether it's with the isolation that has come with some of the quarantining, or whether it's some of the real personal and family situations that people are experiencing. So from a psychological health and safety lens, this pandemic has created, I like the word opportunity, it sure is an opportunity. If you don't have a strategy for psychological health and safety in your workplace, or a mental health strategy, there is no time like the present to really get started down that road. Prior to COVID-19, you know, in education sessions, we would talk about this 1 in 5, you know, there are 1 in 5 people in your work population who will be requiring care and support and maybe treatment. We know now the research is coming in, some pretty loud research, which is telling us sometimes that number now might be closer to 1 in 2, or in some work populations, even a little higher than that. And these are people who are expressing moderate to severe levels of stress and anxiety, which of course we know, aside from the angst and nasty feeling that can bring to you, it can also create longer standing clinical conditions that require treatment. So, you know, good for you as an organization to be here looking for tips and how to actually address it. So big part of the equation is getting started to recognize. So we also know some other interesting research that's been coming out recently. I know for myself, when I put my recycling out, I had to pay attention that my box was a little heavier than usual. We know alcohol consumption has gone up by at least 40%. There's a Canadian study recently released that's saying that for individuals in working age, so between 18 and 65, that you know, in terms of 30% are admitting to binge drinking to deal with and manage the stressors of COVID-19. So as an employer, you know, I find it difficult to dismiss that as a pretty relevant thing for you to know, is that potentially at least 30% of your workforce is binge drinking. If they're working, you know, this is going to have its impacts, but it is a health need that they are expressing through this behavior. So having appropriate supports in place to address those kinds of research statistics that we're hearing about, super important. Another interesting thing we heard this past week, our wonderful medical officer in British Columbia, Bonnie Henry, I'm sure around the world, all of you probably know who she is. She talked about the opioid numbers in May in BC being the highest ever. The opioid crisis is not happening uniquely to a group of people who congregate in an area of Vancouver. The opioid crisis is live in every workplace. So these are the kinds of issues that are existing there, whether or not you as an employer have had to pay attention to them. If you are wanting a smooth transition and you're going to want to help everybody be the best that they can be to participate in this return to work, however that looks in your organization, you need to be aware of what's happening in your work environment. So I just want to show you one image. So I really like this image to frame. This is really where I'm getting my recommendations to you. For those of you who are working in the workplace, you're interested in knowing how to address psychological health and safety and where to get started. Maybe you already have a program in place. You've adopted the the national standard for psychological health and safety, or you have put some mental health supports and services in place. This image for me says everything that you need to know going forward to get started on the path. And I've put on this list, first describing what you're looking at. So this is a continuum, a mental health continuum. We often use this continuum to describe everyone's experience with mental health, that we're not either healthy or unhealthy, and there's this line we cross, but that it's like our physical health. We have times in our life and even across a period of a day where we are particularly more robust in our mental health. And then we have times when we're less robust and maybe we're reacting to stressors in our world. In the yellow and in the orange zone, maybe those reactions are now requiring more significant help and support, and it could even mean that we're having difficulty in our workplace. And then the red one showing, that's where we're seeing expressions and conditions that now can be named as an illness. So I like to use this continuum to share with employers and workplaces. This is the full continuum of services that you need to think about when you are wanting to address mental health needs and psychological health and safety risks and needs in your organization. Think about all of these. Typically, organizations, there's a typical intervention point. Something happens, something goes wrong. I have had employers, for example, contact me, and they have employees that have been hospitalized recently due to their response to isolating or the added stress of COVID. Maybe they have a lot of personal fears in their family of making people sick when they have to come back into the workplace and they have a vulnerable person living in their home. All of these reasons, typically, when a person leaves work or needs to express to the employer that they can't be working, tends to be the time we pay attention. But there are things that as an employer you can be doing across these three areas. So this is my recommendation in a nutshell. Look to ways that you can protect the mental health that is present, that you can build resilience to those who are present. You're identifying the strengths and positive things you already have in place. That's part of the equation. You need to look at ways to support your workers and employees to detect issues that are happening for them, make available screening tools, and help them reduce the risk of those stressors pushing farther down that continuum. That would be the second point. And then the third point is, and when people are coming forward and you're aware that there are particular needs for individuals, that you address those loud and clear. And then, I want to tag on to lots of Tyler's advice about, communication being key, having your leadership as part of that equation. But if you can just look at all the supports you already have in place, you will have some. Every workplace is doing something along this continuum, and then build on that with respect to the specific concerns and risks that might exist in your work population. So thank you very much. I will now pass it along to my colleague, Jordan.
Thank you, Diana. And just a reminder to our audience, please include the name of the expert you would like to address your question to when you submit your question in the question box. And Jordan, the mic is yours.
Wonderful, thank you. Great, I think, introduction and segue, Diana, to some of what I'm hoping to share with our audience today. Really does center in around this topic of psychological health and safety, and And how do businesses, in particular leaders, keep this concept front of mind when navigating this return to the workplace for many of their employees? And I think they would also apply in the context of workplaces where people have remained at work. Now that we're seeing this transition and gradual reopening in other places of our economy, what are the tips that organizations need to keep in mind? Really practical, tangible stuff that's going to help build a culture and an environment of psychological safety for their staff. And in my thinking, I kind of break this down into three main areas of advice that I would give to employers everywhere. And so the first one is really about leadership. So in times of uncertainty, of fear, of worry, it's really clear, consistent messages from leaders that can help set an appropriate tone and encourage healthy behaviors and really provide that foundational layer of psychological safety. And so as people are returning to their workplace or perhaps adjusting to ways of work that they would have used previously, there's a few key messages that I think leaders need to be really attuned to. The first is that, I think as Tyler mentioned, this is not a return to business as usual. And even though we may be returning to a workplace or returning to old ways of doing work, we're not through this pandemic yet, and that adjustment here is going to take time. I think going along with that, I think leaders can convey the expectation to their organization that it's expected people are going to experience challenges with this transition, and challenges in particular with their mental health, and for many reasons. One, because we're all living through a pandemic, and two, because change is always being forced upon us in this context, whether it's leaving the workplace or returning to the workplace. Often we don't have a choice, and so it's anticipated that people are going to be struggling with this transition. It's anticipated that it's going to feel stressful, that people are going to be worried about it, and all of those feelings are quite normal. And so the final message, I think, from leaders should be that all staff should seek appropriate supports for their mental health if and when they experience those difficulties transitioning back to the work environment. And so this is especially relevant, I think, for supervisors as well, and they can certainly mirror that messaging to their teams, and prioritize time to actually check in with employees and understand what their challenges are in that return to work, both from a psychological perspective, but also from a very practical perspective. What are the things that are making this challenging? What are the things that are making this a stressful experience for you? And the more you're connecting to employees that are going through the process, the better you're going to be able to respond to their concerns and pivot accordingly. The second key piece of advice centers around support. And so, again, very much to what Diana was saying, CMHA would encourage all workplaces to take a really proactive approach to supporting employees experiencing mental health issues. So ideally having supports in place, not just once someone becomes ill, but ideally when they start experiencing signs of illness. And so we would also suggest that those supports, and they be enhanced first and foremost, but that they be kept in place for a long period of time. So what we know from disaster recovery and some of the psychological impacts of disasters is that these impacts can last for years, and we can see these at a population level for years. And so from an employer perspective, again, building on what Tyler said, think about what are the ways in which you're currently offering psychological supports for your employees. Make sure that they're aware of them. So make sure that the information is widely disseminated, continuously disseminated, and then think about what else you can add. And those additions, keep them in place for the foreseeable future. And then finally, safety is the third piece. So leadership, support, and safety. So the foundation of a psychologically safe environment is safety in every sense. And so what we would suggest is certainly in that return to work, continuing to reinforce policies and procedures to address disrespect, incivility, bullying, and harassment. In particular, if people are experiencing stress and anxiety, some of those behaviors can come out a little bit more than maybe would be expected usually. And then particularly important, ensure that employees understand what the crisis response is. in your organization. So if, for instance, someone were to contract COVID-19 in your building, make sure that employees know what the plan is, how you're prepared to respond, and what they can expect. So it creates a sense of safety and predictability that they know what's going to happen if this should occur. And so, you know, in the spirit of ensuring that the other panelists have some time to continue to contribute as well, I'll leave it there. But leadership, support, and safety would be my 3 areas of recommendation. Again, all aligning with the concept of psychological health and safety.
Thank you, Jordan. And we will turn to Kevin next.
Okay, thank you. I'm going to begin with an apology. My webcam fell off its mount just as we began the session. So I have something jury-rigged here, and I know you're looking up, but I have a nice ceiling fan you can look at as I get boring. And second, I think I'm going to largely reiterate what was just said. I'll tell you a bit about where I'm coming from on this. We were lucky enough to get a CIHR-funded research project sort of very at the beginning of the pandemic. And so we had a chance to collect some data ongoing about how organizations are responding and how employees are reacting to that response. And this is work I'm doing. You can see my co-authors there. I hope you can see my screen. Stephanie Gilbert at Cape Breton University, and Jane Mullen at Mount Allison, and Jen Dimhoff at University of Ottawa. And we pitched this nice idea to do a study. We got the money and then quickly realized that the world had changed overnight. So we had to start focusing on a whole bunch of different groups, as someone referred to earlier. I saw someone saying it's not that we're all in the same boat, we're all in the same storm, but we're all in our own boats. And I think that's very true. We've had different groups of people. Some are telecommuting, working from home. Some have become unemployed. Some have kept working, but now the workplace has changed dramatically. So all kinds of different effects going on. And to try to capture that, we've ended up running a whole series of studies. So we've just finished some longitudinal data collection on 2,000 Canadian and American employees, sort of widely spread. We have another 3-wave longitudinal study on retail workers because they emerged as a sort of separate group. We're collecting data now on healthcare employees, and we're doing some data collection on people working at home. So we're trying to tap all the varieties of experience. But when we were asked to sort of put together our 3 recommendations, I went back through the data we have to try to identify, you know, what's the data telling us. And some of it's already been mentioned, but maybe it helps to put some data beyond it. So our research has been based on the notion that the pandemic is a traumatic stressor. You know, it fits all the definitions of an acute stressor. We know when it began and things like that, but it's really sort of been very traumatic for people. One of the reasons for that is, like occupational health and safety in general, public health and public health messaging is largely driven by fear. We're told, you know, you need to do this, you need to wash your hands, you need to wear the mask, you need to use sanitizers. If you don't do that, something bad is going to happen to you. And in this case, it really is. So fear is a very, very adaptive response. But one of the things we're finding in our data is, even now as we're sort of transitioning back to work in many jurisdictions, that individual level of fear is remaining very high. So people are coming back to work. You know, we think a lot about what kind of workplace are people coming back to. I think we should think a little about who's coming back to. And the people who are coming back are very fearful, very anxious, have been conditioned to be that way. And that's been our self-protective mechanism, but they're bringing that back to work too. We started with this idea that the pandemic is a traumatic stressor, and I think what we found is that traumatic stressor experienced at the same time as many other life stressors. So not only are you dealing with all of these changes to normal activities, and you know, there's all this fear of infection and things, but you're doing that while simultaneously trying to work and manage childcare, and maybe you're under some financial strain or experiencing job insecurity or all those other things that have happened at the same time. We're seeing this in our data, very high levels of stress, and in particular, very high levels of PTSD. We're using an instrument that gives us a screen for PTSD for a civilian population, and we're finding regularly 20 to 25% of our respondents across all these studies are scoring in that PTSD range. So that's about the same level you would expect from, you know, emergency room nurses or paramedics on the job or something like that. Certainly not what you expect in a general study of workplaces, not what you expect from office workers or retail workers or something like that. So that may be picking up on just the very high levels of anxiety that are around, and it'll be interesting to see how that unfolds. Our data suggests that's coming down a bit, but not a lot. So still remaining very high, even as we hit the end of some of our studies. We've been looking at what conditions some of those responses, and employees are very aware of what their organizations are doing and what their organizations are saying, and they're very watchful about that. I think you can expect as employees come back to work, they're going to be watching what employers are doing and be very attentive to whether safety is being maintained, because they don't want to be at any greater risk. And we've certainly seen that in our data. The more organizations have responded appropriately and put protections in place and communicated around the pandemic, then the more employees were engaging in those behaviors that we wanted them to engage in, you know, the social distancing and the self-protection, the hygiene, and all those sorts of things. So it's going to be very important for organizations to be the role models here and very much, you know, set the standard by doing the right thing. And finally, Jordan talked a little about this, and it's certainly backed up by all the data we have. One of the things driving employees' level of stress is leadership, both good and bad. Good leadership and leader support for individuals is decreasing stress. Bad leadership or you know, leaders who just aren't involved and not providing information are contributing to employees' stress. So I think that's another thing we're going to see as we come back to the workplaces. Leadership has always been important. You know, we have tons and tons of data on this for many, many years now. But it's even now more important because the people coming back are not the same as the people who left the workplace originally. People coming back to work are now very stressed, very anxious, very fearful, and trying to manage now this new reality of coming back to the workplace while at the same time protecting themselves and protecting their families and dealing with all the other stuff that's going on. So this is as previous panelists have spoken to, this is really a time to focus not only on the physical health of employees, but on the mental health of employees, because it's already been adversely affected. And that's probably enough for me.
Thank you so much, Kevin. And let's give the floor to Chris.
Hello, everyone. My name is Chris Back. I'm Director of Compensation Education Services at WorkSafeBC. And I am, unfortunately, I'm unable to be joining you video today, so my apologies on that, but I threw a picture of myself up on the first slide here just so that you can put a face to the name. So my focus today is really going to be talking about WorkSafeBC's approach. And if you're not familiar with WorkSafeBC, we are the regulator within British Columbia for the Occupational Health and Safety Regulation, the Workers' Compensation Act. So our focus here is very much on what employers are required to do in the scope of health and safety, and the approach that we are taking specific to COVID. And so what I'm going to focus on here for a few minutes is really around developing the COVID safety plan, which in British Columbia is a requirement, and how that can reduce the risk of exposure of COVID within the workplace. So a provincial order on May 15th was issued in British Columbia that requires all employers that fall under WorkSafeBC's prevention mandate to create a COVID safety plan. And not only that, they are required to post that safety plan within their workplace and have it available to essentially anyone that would come into the workplace, so including workers, contractors, service providers, or the general public. Now, there is a misperception that those plans need to be approved by WorkSafeBC before the employer can either resume business operations or continue with their business operations. That's not the case, so we are not reviewing or approving plans. However, we have about 300 officers in the province who are doing inspections, taking a very consultative approach to this, recognizing that this is a new risk and a new issue for everyone. And speaking to a lot of what the other panelists have talked about related to fear and the recognition that this is a very uncertain time and challenging for employers, that we are really trying to work as best as we can with employers in order to ensure that they have these steps put in place. So when our officers are out there doing inspections of employers, that they will be asking to see that plan and see that you've gone through the 6 steps in the plan, which I'm going to walk through here in just a moment. So as employers are putting together their plan, their COVID safety plan, first and foremost, they need to understand the orders, the notices, and the guidance from the Provincial Health Officer and the BC Centre for Disease Control. So I've mentioned the order already specific to the requirement for a COVID safety plan, but depending on which industry you're in, there may be other orders specific to your industry, such as food services establishments. There is a specific order for food services establishments. So as an employer, you first need to really understand what's written within those orders. And then everything in the 6 steps really comes down to the basics of physical distancing, cleaning and disinfecting, and personal hygiene. And you'll see that as we walk through this. So these are the 6 steps. We have a template. I'll show you a link to that. And my understanding is you will have access to these slides afterwards. So I'll show you a link to that in a moment on our website. And it essentially walks through the 6 steps. The first being assessing the risk. So understanding where all the potential opportunities are within the workplace for exposure to COVID. Second, once you understand where those risks are, implementing control measures to reduce the risk as much as possible. I'm going to walk through those 2 in a moment. I'll dig into those a little bit more. But then once you've done your risk assessment, you've implemented controls, then you want to ensure that you have policies and procedures in place that are going to support the control measures that you've created. Step 4, ensuring that your entire workforce is familiar with the COVID safety plan, the controls you have in place, and have received any training that might be required. So if you have new protocols around cleaning and disinfecting certain areas of your workplace, you want to ensure that those people responsible for that training or responsible for those protocols have been trained and that supervision is in place as well. Step 5 is really around sort of that plan, do, check, act approach, not just developing your plan and then setting it off to the side, but ensuring that you are revisiting that plan as you move forward. Step 6 is a bit outside of the realm of the COVID risk, but it's also understanding that as employers are starting to resume operations again, that there may be other risks that become apparent that may not have been there in the past, and you need to ensure that you're not so focused on COVID that you miss those other risks that could cause injury or illness for workers. So I'm going to dig into step 1 and 2 a little bit, and then we'll move on to some resources available to you. So with step 1, and the reason I focus on step 1 and 2 is because they are really probably, if you don't get that part right, you're going to struggle with the other steps. And step 1 is really around assessing that risk. So asking questions such as, where do people congregate? What job tasks or processes require workers to come into close proximity with one another or members of the public? What tools or machinery or equipment are used throughout the day by regular people? Which surfaces are touched often by people? And that's really where you need to focus your efforts, so you can understand that with the transmission mostly occurring where people are within close proximity of each other or frequently touched surfaces, that's where you want to look at control measures being put in place. And then this last point around involving frontline workers is key. And you know, many of the other panelists have talked about the fear and the psychological health and safety aspect of COVID, and that uncertainty of the future, the fear coming back into the workplace, the fear that people are going to be exposing themselves to this by coming back to work. By involving your workers throughout that process, it will help to reduce that fear. Have them involved in the risk assessment, have them involved in developing those control measures. Now in BC, there are requirements depending on the size of your employer around worker involvement in health and safety, whether it's a joint occupational health and safety committee or a worker health and safety representative. So you'll want to ensure you understand your requirements there, but this is beyond just these requirements. This is an understanding that by involving your workers, it is going to help to reduce a lot of that fear. Step 2 again, is about implementing the controls once you understand where the risks are, focusing on maintaining physical distancing. Where you can't maintain physical distance, then other measures that you can put in place, and in hygiene. And I like to show this slide. This is what we in our geeky safety world refer to as the hierarchy of controls. And it shows that those controls at the top of this reverse pyramid are more effective than those at the bottom. And I'm going to actually jump to the bottom first, where we talk about personal protective equipment. People tend to jump to these non-medical masks and stuff like that as the focus on controlling this risk, and recognizing that that isn't enough. We really want you to focus on eliminating the risk, maintaining the 2 meters of distancing, then getting into engineering controls such as plexiglass barriers, and then administrative controls like the rules and guidelines and flow within your business. So I'll just show a couple more slides here. So we've got the COVID safety plan template with a link there that you can access on our website. You don't have to use our template, but it's there for you. Recognizing that workers have responsibility as well. They also have rights, the right to know, the right to understand, and the right to refuse unsafe work within BC anyways. So involving your workers is a key first point in that, and then the refusal of unsafe work process. A couple resources that are available to you if you go onto our website. This is a picture of our homepage. Click on the little blue shaded area with the COVID virus. It'll take you right to our COVID page, which has industry-specific protocols and guidance. They aren't requirements, they're just guidance for you as an employer to start things off. If you do continue to have challenges, you can contact us directly. Our prevention information line is available 24/7. The 2 numbers are there in the bottom right-hand corner. We also have a list of some specific resources that we've created and provided some links here for you to be able to access those resources that might help you come up with your plan within your work site. And I will end it there. Back over to you.
Thank you so much, Chris. Let's move on to the Q&A session without further wait. So the first question is for Diana. When you suggest that employers look into ways you can protect the mental health of employees in the workplace, have you found a practice that works best for this intervention?
Yeah, so I actually am going to swing back to Chris's slide on the steps that you take, because really the most important thing that you can do with any initiative is that you're first going to evaluate and assess what those risks are and what the opportunities for protection are. So every workplace is going to be different. Use the example of PPE being on the lower level of control. But it could, for example, in your environment, the availability of PPE or the lack of availability of PPE may be a really significant psychological risk for your workforce. If you have a workforce where people are exposed to people who have COVID-19 or have a high potential for that. So you really need to look at what your own work situation and what your own work population brings, and then protect what you can for those risks. We know that social support, for example, is a huge antidote, I should say, for negative impacts from workplace stress. So if you know that the work environment during this return to work is pulling away social support, people are not in groups anymore, they're not having access, that's something that you can be doing to protect them. So really going to evaluate the own needs of your workplace. And education, provide as many opportunities you can. Teach people how to help themselves, get them connected with the resources for self-care. Self-care looks different in COVID-19. People in very high stress jobs had pre-COVID a really robust plan for themselves on how they managed all that stress with activities that they undertook. I know for myself, exercise, a super big part of this. My gym closed. That's a major important way for me to protect my mental health as an employer, to help promote whatever opportunities you can to allow your workforce to be doing those self-care, learning how to do it, and equip supervisors, HR and occupational health and safety people, and the people at the very top of the organization can only have so much impact. So give those tools to your supervisors and frontline managers to be building the protection.
Perfect. Thank you very much, Diana. And next question is for Tyler. So for companies who are fortunate to be in a position to actually renovate their office space as this pandemic unfolds, would you tell them to take advantage of that opportunity? And if so, what design ideas would you incorporate?
Excellent question. You know, it's a great position to be in, to be able to influence the structure, if you will, and the design of workplaces. From my perspective, you know, I started out working in ergonomics and design to reduce the likelihood of injury and illness. So this is I've got a soft spot in my heart for this. You know, that being said, you know, definitely I would take the opportunity to do that. You know, looking at what Chris showed with regards to the hierarchy of controls, of course, engineering out a lot of the risk is definitely in our best interest. Now, whenever we look at the Ball's energy model or the hierarchy of controls and how we go about, you know, engineering out or reducing the risk of injury or illness within our workplaces, you know, typically communicable diseases like COVID-19 or the SARS-CoV-2 virus don't bubble up to the top of the list, for lack of a better term. You know, in this case, you know, people are human-to-human transmissions or person-to-person transmission is really what we're worried about. We are worried to a lesser extent about what's called fomite transmission. So that's, you know, people touching a commonly used surface and then touching their eyes or touching their nose or their mouth. You know, very difficult to get people to change those behaviors. You know, you touch your face very often throughout the day. But that being said, you know, the risk models are very much favoring the human-to-human transmission within that envelope of approximately 2 meters or 6 feet as a primary source of transmission amongst individuals. Now, of course, we have to look at it through the lens of, well, who's going to be most likely to transmit? Typically speaking, in the workplace, we're going to be worried about people who are what's known as pre-symptomatic. So before they actually develop any symptoms or asymptomatic. So there is, you know, a growing body of evidence around the number of people who are in fact asymptomatic transmitters of the virus. So whenever I work with employers, you know, we focus in on that group because we believe that we've got sufficient controls in place to stop people who are in fact asymptomatic from interacting with others in the workplace. So whenever we're focusing in on the pre-symptomatic and the asymptomatic group, it definitely makes our jobs as health and safety professionals a little bit easier because we only have a shorter window tied where people can actually infect other people. Now, that being said, people who are asymptomatic tend not to shed as much virus or for as long as people who are symptomatic, so which is quite good in that sense too. So we do have some things that are positive. Now, from a design perspective, you know, the best thing to do is to incorporate controls whereby we're factoring in that 2 meter level of physical distancing in place. So if there's somebody who's going to be asked to interact with a lot of people, you know, barriers are definitely a way to go. You know, why not build those in? You see these sort of things all over the place. You see makeshift ones today. You know, if you have the ability to break that in where it's not going to have a detrimental impact on the level of customer service or something like that, then by all means, that's definitely worthwhile. I think for this particular virus, you don't really need to consider, you know, HEPA filtration on your HVAC systems or anything like that. This virus is primarily spread through person-to-person transmission via droplets. So, you know, it's not like measles or something like that where we have to worry about, you know, other aspects that are, you know, extremely expensive and, you know, more bang for the buck when it comes to actually doing something like this. But that doesn't mean that the next virus that comes out and causes a pandemic is not going to be airborne in nature. So I always have to weigh the pros and cons of these sort of investments. So from a practical perspective, you know, incorporating in physical barriers wherever possible to reduce the ability for people to interact closely with one another is definitely key. Administrative practices around, let's say, if you've got common rooms or cafeterias or things like that, you know, if you've got more space, use that space. Space is to your advantage to these days, in these days. And of course, you know, we know that PPE is the least effective, but unfortunately, when it comes to communicable diseases like what we're dealing with right now, you know, having those sort of, you know, fallbacks are definitely in your best interest. So making sure that, you know, there is use of these sort of things. And I realize that that's well beyond the idea of design, but it's something that needs to be considered as just another tool in the toolbox about how you can create the most safe work environment possible. And if you have specific questions, I'm more than happy if you send me a note. I can elaborate on some of the other requirements. Of course, Chris did show some tools that are available. There's lots out there around, you know, what would make sense from a physical barrier perspective.
Perfect. We'll be collecting questions and sending them your way, Tyler. I know you're limited with time. So the next question is for Jordan. So during quarantine, many people have had mental health impacts from isolation. What mental health concerns can arise from reintroducing them to a formal workplace?
That's a good question. And I think a lot of what I would say mirrors what Kevin had described just a few minutes earlier, in that this pandemic has been a traumatic incident for many people, particularly those that have loved ones or friends or family members that have been affected. There's people that have unfortunately experienced the death of family members and loved ones from this pandemic as well. So, you know, in the context of a return to the workplace, I think recognition of some of that trauma is really important, and that people might be experiencing certainly the lingering effects of things like grief, for example. You know, we will likely see a rise in incidents of post-traumatic stress disorder and other related anxiety disorders as well. So I would expect those will be issues that aren't directly tied to returning to the workplace, but are linked to the experience we've had that's been quite traumatic. In terms of returning to the actual workplace, I would expect that very likely employees may be experiencing a degree of anxiety related to that return. Again, because the chance of them then being put in a place where they're experiencing that traumatic stressor is high, or higher rather, than if they're simply physically distancing inside their own home. So, you know, an important consideration, I think, to tie it into some concrete action around benefits and planning for benefits and any changes to those would really be to take a close look at how trauma-informed those services are, ensuring that, for instance, your EAP counselors are able to operate from a trauma-informed approach, and that there's some sensitivity to that trauma from your benefits provider and how they're providing services. So hopefully that answers the question.
Thank you very much, Jordan. And let's turn to Kevin. The next question is for you. So after being away from your team for an extended period of time, there is bound to be a shift in workplace culture. Is there anything an employer can do to promote better communication and encourage establishing positive relationships between colleagues?
Yeah, it's a great question. We often talk about the vacation effect. You know, when you're on vacation for 2 or 3 weeks in the summer, and you come back to work and you're sort of out of the loop. You don't know what's going on, and you don't know that coworker A is now fighting with coworker B, or, you know, you don't know all the dynamics, and it takes you a couple of days to settle in. So now we have the vacation effect on just a massive scale, right? So a lot of people have been out of the workforce since what, mid-March, sometime around there. Some of us, I know at least at universities, we will be out of the workplace at least until January of 2021. So in the fall, we're going to be a virtual university, so we're not going back to the work. And there's, I've been thinking as sort of an organizational psychologist, there are some real questions there now about the bonds that tie individuals to workplaces, and how closely you're now going to feel affiliated to that workplace. So my everyday routine was to get up and drive to the office, and, you know, I'd work in the department and I'd see those people. And now I don't do any of that. And I'm not going to do it, say, for a period of 8 months. That's bound to have an effect on sort of relationships in the workplace and how we interact. So it's, you know, it's a grand social experiment. Nobody knows the answers to this. I think the best thing for organizations to do at this point is to recognize that's what's going on and have some purpose of planning around that. So maybe we have to build social time into the workday. Now, I know that's heresy for some people, but maybe that's what has to happen to reestablish those relationships and to make some time for us to get together and talk about our experiences, you know, and what we're going through now in coming back, and try to rebuild that culture. I think that's an important part of the social support that Diana was speaking about earlier. But we have to be purposive about it, because it's not just going to happen. You know, it's going to get pushed out by all the work stuff that needs to be done too. But we have to recognize this is important. We have to plan for it, and we have to start building in those opportunities into our day to start reestablishing those connections.
Thank
And
you,
that would get
Kevin.
that would get a hearty endorsement from me as well. I think it's the idea that we're going back to the workplace, but it's not business as usual, and we can't expect it to be. So those really tangible things like making time for that social connection, a really practical takeaway.
Thank you both. Our next question is for Chris. So for someone who was laid off at the beginning of this pandemic, what recommendations would you have for them in terms of fearing for job safety?
Yeah, thanks for the question. It's a good one, and I think it goes back to the slide I showed on for employers in terms of ensuring that they've included their workforce in the planning of the COVID safety plan. I think it goes the same for workers and workers that are coming back into the workplace, as well as workers that are potentially looking for another job. I would suggest that you are having that conversation with the employer and asking to see that COVID safety plan. Look at what they've put together, get an understanding of the job tasks that are associated with that employer or the job that you're coming into, and kind of almost do your own risk assessment. Understand where you think there might be potential for a risk of transmission based on the information you know, and ask to see that plan and ask to see that they put those control measures in place to create some comfort for you as you're going through that process of coming back into the job market.
Perfect. Thank you so much, Chris. And we'll conclude with our last question. We received many questions, so we'll make sure to collect them and send them to our panelists, if you don't mind. So our last question is directed to Kevin, but please feel free to add on to it if you would like. So are there any specific response recommendation for employees with disabilities or visible minorities?
Not so much a recommendation. I guess the recommendation is to be aware of the potential effects of some of the things we plan. So we can think about if we're putting in physical barriers in the workplace, screens or things like that, how is that going to affect somebody who has a mobility impairment? Some of the other things we're asking people to do, anyone who works in long-term care, for example, recently has found out how many of their residents are actually lip reading half the time. Because now as we have healthcare workers wearing masks, their residents can't make out what they're saying, not only because they're muffled, but because they're so used to reading your lips rather than actually hearing you. So people with a hearing impairment, wearing masks is going to be a struggle for them to communicate then in the workplace. So it's something I think we have to be aware of and think through. It's a good idea as we're thinking through any of those modifications that we're making to the workplace or to the work rules, to explicitly build that into the process. How is this going to affect somebody with physical disabilities? Right? Are there special considerations for visible minorities? And early in the outbreak, there were reports about actions taken against people of Asian descent. We have to be aware that that can happen again, and we should be sort of monitoring and making sure that nothing inappropriate is going on in the workplace. So it's really, I think, a big issue of awareness.
So I'd just like to add to that as well that individuals who have a pre-existing impairment or disability, be it physical or other, there are also psychological disabilities or mental health disabilities as well. We know that this group, this working group, if they were fortunate enough to be employed, because their employment rates are lower than for those of us who may not have a disability, that they are more impacted by the COVID-19 changes than anybody else in the population. So as an employer, if you know, and there are people in your workforce who have identified disabilities, they may need special attention. Reach out to them. And accommodation is the name of the game. So I would say this extends as well to issues that may relate to race and potential discrimination that we're looking to as an organization to address the realities that COVID is bringing a spotlight on, and that some of the other issues that are happening in the world are bringing a spotlight on. So by being aware, creating opportunity, invite the dialogue, and then you can know how to accommodate those people.
Perfect. Thank you.
Sure.
So we will compile the rest of the questions and send them to our panelists. Thank you so much for your participation. We're arriving at the end of this webinar. We want to thank our panelists for helping us navigate through work wellness for the return to the workplace. Thank you for your tremendous contribution to toward making our workplaces safer and healthier. Excellent information. Thank you. We would also like to thank our amazing audience for your active participation. Stay safe and take good care of yourselves. Immediately following the webinar, you will be directed to the evaluation survey. We greatly appreciate your input on our webinars as well as suggestions for future topic areas. All of our webinars are created for public access and supported by voluntary donations and memberships. Thank you again and have a wonderful day. Bye-bye.
Thank you.